Okay, so as background, we thought it would be interesting to dive in a little bit about just what is this virus and what does it mean kind of from the science perspective and the implications of that in our daily lives, of course. So COVID-19 stands for coronavirus disease that emerged in 2019. And then the name of the virus is SARS-CoV-2. So this is very similar to the SARS virus that you may remember from 2003. And what it looks like, this is a false color picture of what it looks like, but it's an electron microscopy picture. So the virus is basically an RNA virus with a little surrounding membrane and then these little projections that help it get into cells. Coronaviruses are actually a huge family of viruses in a large number of species, and they do cross species, so they're able to infect humans as well as other species. This virus seems to have originated in horseshoe bats, but the scientists are still trying to pin down exactly where it came from. And then, of course, people like to compare what is the difference between this virus and the flu, because they're both respiratory viruses. COVID-19 has a longer incubation period than the flu. It also has more asymptomatic spread. And what that means is that there's higher transmission, because people can be walking around feeling just fine and not knowing that they're infected. Yet on the left here, this is a picture of a cell, and the orange little balls basically on here is the virus that has virus particles that have replicated inside the cells and then burst out of the cell. So as you can imagine, you get a lot of virus particles for any one cell that's infected. It's estimated that there needs to be 60 to 70% of people that would be immune before the pandemic ends. And the current estimate of Californians is that we're at 1.6% of Californians who have been infected in total. So of course, this means that vaccines are extremely important. I have to give a shout out to all the medical and scientific inquiry, because of course this is a brand new virus. It didn't used to be in humans up until December. And there's been global collaborations and just a huge amount of open sharing of scientific data. This was published last week in one of the highest, most prestigious journals called Cell. Basically, what they did was they looked all along the respiratory tract at different cell types, and they looked to see where does the virus infect. And so on the left, anything that's red here is the SARS virus, and then the blue are the cells. And this top one is from the trachea, so very high up in your respiratory. The next one is further down in your lungs, the bronchiole and alveoli cells. And you can see there's not nearly as much infection deep in the lung, because it's only a certain cell type that deep that has the receptors. So of course, with an upper respiratory infection, that means when you cough or sneeze, everything's widely available to be coughed and sneezed out because it's in the upper part of your respiratory tract. And that's why, of course, masks are needed. This is just a little schematic of what the virus is made of. It's actually pretty simple. It's a little ball. It's got a membrane, a bilipid membrane, and then it's got these little spikes on it. And the spikes are basically what will attach to the human cell receptors that allow it then to enter into the cell. And as I just showed on the previous slide, it only enters certain cells. Most of those are in the respiratory tract, but the receptors are also found in other cells in the body, such as the gut, and it's believed that that may be why some people can get diarrhea as a symptom, and also other cell types, including heart, kidney, liver, and so on. It's called coronavirus. Corona just means crown. So when these types of viruses were first looked at under the microscope, they had this nice ring around them that was kind of pretty, and it looks like a crown. So, but then the little spiky parts are the part that will adhere to human cells to allow them to infect. And then the symptoms, of course, go along with the infection. So this is straight from the CDC. And I can share these slides with Pastor Josh so that you can have them, because on each slide I've also given links down at the bottom where you can look at the original references and read more about anything you're interested in. But these are the general symptoms: fatigue, loss of sense of smell and taste, cough, fever, muscle aches, and so on. Kids do not seem to be as symptomatic, and it's also thought that they might not carry the virus for as long. So either their infections are more mild, or they're just somehow a little bit better equipped to deal with it. Generally speaking, when kids get the virus, they get it from adults around them. The symptoms are also a little bit more brief, but I think part of that could be just because kids haven't been studied as much. There are rare cases where children can get a very severe disease, Kawasaki, yeah, which is basically a hyperimmune response. And then, of course, the really tricky thing about this virus, compared, for instance, to the original SARS, is that a fairly significant portion of people are asymptomatic, which means they can be infected, but they really just don't feel bad. And the reason that's that's good for them, but the reason that's a problem is because if they're out acting normal because they feel fine, they can be spreading the virus. And then, of course, the reason there's so much concern about is that a subset of people, a minority of people, can be severely ill. So there are mortality and deaths associated with the virus. The risk factors for the severe illness are listed here. Again, this is from the CDC. And I just showed one graph for the first two characteristics here: age and being male is actually a risk factor. And over here on the right, these numbers may be too hard to see, but this is US COVID deaths split by age and gender. And so gender, men here are in blue, and the gray line are women. And of course, it's rising with each decade of age. So this chart starts at 44 years, and then every decade, 45 to 54, 55, 65, 75, and 85. So you can see there's a dramatic increase in the severity of disease starting basically around age 65. And the virus, of course, because it lives in the largely in the upper respiratory, that's how it spreads. So it spreads through droplets, aerosols, or fomites. And the difference is shown here on the right in this little schematic. So if this person on the left here that has the red color, if they cough or are breathing heavily or something, the virus will be emitted and can be transmitted either in droplets, which is defined by this certain size, fomites, which are just bigger, heavier droplets, so they drop to the surface, and that's why we want to clean everything, or aerosols if they're very tiny particles. And of course, what this means is that we can prevent transmissions by wearing masks. We can also prevent transmissions by cleaning the surfaces where there may be droplets or anything. They have studied how stable the virus is. Basically, of course, you can kill the virus with soap and water. You can kill it with disinfectants, alcohol. It will die on its own if something has dried out. There have been studies looking at how fast, if you put the virus on a surface, how fast it can dry out and die, so that it will no longer be infectious. That also relates to the size of the droplet, because if it's a big moist droplet and the bigger it is, the longer that the virus particles can last, just because they won't have dried out. One very important aspect is that the virus is most contagious before and during the first week of symptoms. So while it's getting a hold and starting to replicate in your throat and your nasal passages, that's when you have the most transmission. So right before you feel symptoms and right when the symptoms are onsetting. Okay, so Anna's going to take over.
Yes. So as my mom always says, an ounce of prevention is worth a pound of cure. So one of the really important things we can do to help prevent the spread of COVID-19 is to wear a mask. And so as you can see in the graphic over here on the slide, if a healthy person is not wearing a mask and they interact with a sick person who's also not wearing a mask, there's a very high probability of transmission. And then if the healthy person is wearing a mask, but the unhealthy person is not, then there's still, moderately high probability of transmission. And then if the COVID-19 carrier is wearing a mask, but the healthy person is not wearing a mask, that lowers the probability of transmission more. And then if both of them are wearing a mask, that's when you get the lowest possible transmission probability. So the important takeaway here is that we want everyone to be wearing masks, because as my mom has mentioned multiple times, and one of the points we really want to drive home is that there are a fair number of asymptomatic carriers, at least 25%, that's the current estimate. And since you won't necessarily know if you're carrying the virus or not, it's safest to just wear a mask and to have everyone wearing a mask. And then so a few more things we can do to prevent the spread of COVID-19, according to the CDC, are washing your hands often, avoid touching your facial area, avoid close contact with other people, which of course involves social distancing, staying home as much as possible, not gathering in groups, staying out of crowds, that sort of thing. Wearing a cloth face cover, as we said, wearing a mask of some sort when you do have to go out. Covering your coughs and sneezes, of course, not into your hand. I would like to add preferably into an elbow or into a sleeve or something like that. Cleaning and disinfecting surfaces, as we said. And then, of course, monitoring your health and monitoring how you're feeling. Because even though, as we said, people can be symptomatic, there's still, the vast majority of the population will feel symptoms. So it's very important to monitor your personal health and keep that in check. And if you are ill, you should stay home at least 14 days, and then an additional 3 days with no symptoms. And so due to the current state of the pandemic, there is no zero risk outing right now. So if you leave your house, you're putting yourself at risk and you're putting others at risk. So some low risk activities at the moment are spending a day at the beach, going to a vacation house with another household, camping, exercising outdoors, not in a crowd again. Lower to medium risk would be staying in a hotel or having a backyard gathering with one other household. Medium to high risk would be something like an outdoor wedding celebration because there are more people, eating indoors at a restaurant because there is the ventilation isn't as good as it is outside. Getting a haircut, same thing, ventilation problems. And then high risk activities would include choir, indoor religious services, unfortunately, nightclubs, and exercising in gyms and that sort of thing. And super spreader events, which are things like gyms, loud bars, choirs, churches, etc., are thought to be responsible for approximately 80% of COVID infections. So we're trying to stay away from those things now to not exacerbate the current problem. And the general rule of thumb for transmission risk is the more time you spend around people, the closer in space you are around people, and the higher number of people you interact with, those things all increase your risk, especially if you're indoors. Because when you are outdoors, the air is circulating much more freely, and indoors, obviously, you're not in open air. So of course the air is going to be more closely contained. And then, so the current status in San Mateo County as of May 31st of this year, there are 2,165 total cases. And as you can see in the graphic on the left, it's leveling off-ish. The big spike in the middle of April that you see was, for whatever reason, there was just a really huge influx of data that day. That's what caused it. That was kind of an anomaly. But overall, San Mateo County is doing relatively well, and we seem to be flattening in general. And then cases by age group and deaths by age group is the graphic on the right. And this, as you can see, demonstrates that the age group with the most cases here is the 30 to 39-year-old age group. However, the age group with the most deaths is the 90+ age group, even though they have the fewest number of infections. So this, again, clearly demonstrates that age is definitely a risk factor, especially 65+, as we said before. So that's why people need to be extra cautious when you're older, and to take as many precautions as possible and avoid going out as much as possible. So here's a look into the future. There are lots and lots and lots of vaccines being tested, and the possible outcomes are great, which would mean the vaccine prevents the disease and eradicates it, like the smallpox vaccine, for example. Another possibility is that the vaccine is good, which means it would lessen the severity of the disease, like the influenza vaccines. And then the last possibility for an outcome is not good, which means the vaccine could worsen the disease in some people by enhancing the immune response, which is definitely something we do not want. And then another solution we're looking for to control the virus is contact tracing, which you may or may not have heard about. And this essentially involves installing apps in people's phones or some sort of wearable device that could stop outbreaks early and save lives by tracking the people that the infected individuals come into contact with. But with this comes the need to address various privacy concerns as well. And so, in terms of how long this will last, it's estimated that the length of this pandemic will be approximately 18 to 24 months. And scientists have made 3 possible model scenarios for what exactly this will look like over the course of the next year to year and a half or so, year and a half to 2 years. So as you can see in the graphic on the left, scenario 1, peaks and valleys, which essentially means that the spring 2020 COVID-19 wave is followed by a series of repetitive smaller waves that occur through the summer and consistently over approximately 1 to 2 years, and then gradually diminish. Then the fall peak, in which the spring wave is followed by a larger wave in the fall or winter, and then followed by smaller waves. And so unfortunately, this pattern is similar to the Spanish flu pandemic, when there was a smaller wave in early 1918 and then followed by a huge spike that fall and a third major wave in early 1919. And the reason for the subsequent large peak is because people got tired of wearing their masks. And so people would go out without their masks on and be coughing on each other and breathing on each other, and hence you get a giant wave, and nobody wants that. And then the third, less likely scenario is the slow burn of ongoing viral transmission without any clear sort of wave pattern. And so that would vary geographically and be influenced with various degrees of mitigation measures.
So in general, of course, we've all been living with this and adapting to this for several months now. And I think we've learned a lot as we've done it, but we do have to create a new normal for ourselves. And so thinking about how we live our lives, what it means to be out in the world, what it means to be a Christian in this time, I think those are all the types of things that we'll be examining and really trying to grapple with and understand. How do we continue to do good in the world, and how do we do our spiritual practices?
Was that the last slide? Great. Thank you all so much. Alex, do you have anything you want to add to this?
No, I think that was really, really well done. So thank you. And I agree with everything that's been said. I think the main point is that this is something that is going to be, it's not going to finish anytime soon. We can expect another 12, 18 months to 2 years, and we have to establish a new normal. And really everything at this point, until there is a cure or a vaccine or herd immunity, is figuring out what this new normal is and basically mitigating risk to the best way we can while establishing some sort of normalcy.
Yeah. Thank you.